Hello and welcome everyone in the 5th week of the second semester of your second year. This lecture is the first part about the oral mucosa. This is Dr. Siham Al-Araj. I hope you will enjoy this lecture. Oral mucosa topic will be divided into two lectures. The first lecture will be about the cell histology of the oral mucosa, the epithelium, the lamina propria, the epithelial connective tissue interface, and the submucosa. The second lecture will be more specifically about the special types of the lining mucosa, masticatory, and the specialized mucosa, each one on its own. So what we will learn in this lecture about the definition and components of the oral mucosa. We'll start the epithelium, the lamina propria, the basal lamina, and the submucosa. We'll talk later about the regional variations and the types, quick overview of the types of the oral mucosa. Firstly, the oral epithelium in the oral mucosa is a stratified squamous epithelium, stratified notifying that it is a layer of cells. It's not just one single layer, and the squamous specifying the flat shape of the cells. Now we have different layers according to the cell differentiation. We have epithelial ridges or epithelial rete or pegs, so the surface of the epithelium is not flat, and underneath we have a basement membrane. The second layer after the epithelium is the lamina propria. It has connective tissue papillae, which is a loose matrix providing a frame for blood vessels and nerves and minor salivary glands. This is considered also part of the oral mucosa. Underneath is the submucosa, which is the dense connective tissue separating the mucosa from the underlying bone or muscle. The epithelial cells of the oral mucosa are called keratinocytes because they produce keratin. Keratin is a tough water-resistant protein which resists the pathogenic invasion and friction. Skin is normally keratinized epithelium, while the oral mucosa is mostly non-keratinized or actually partially keratinized. Cytokeratin proteins are a family of 20 types. These filaments, they function as part of the cytoskeleton, and also they form the cell junctions, notably the desmosomes or the hemidesmosomes. The special cytokeratins are important in maintaining the metabolic integrity, the innervation, or the epithelial turnover rate. Each type of epithelium is characterized by certain group of cytokeratins. Firstly, talking about the keratinized epithelium, it is composed of 4 main layers, numerated according to the shape of the cell. First is the cornified layer. Second is the granular layer. Third is the spinous or the prickle cell layer. And fourth is the basal layer. Moving down from the most basal layer, or what is called germinativum layer, upward to the keratinized layer, we see maturation of cells, loss of organelles, and more tonofilaments of the cytokeratin. As we have said about the keratinized oral mucosa, the basal cells, they produce new cells which mature and move up to the next layers, replacing the dead cells on the uppermost keratinized layer. The keratinocytes have desmosomes, and they have cytokeratins that are bundled into tonofilaments. Starting with the most basal layer, or what is called the germinativum, referring that here originates the keratinocytes. It is a single cell layer. It has a shape of cuboidal cells. These are the least differentiated. We see tight junctions or desmosomes. We see stem cells which undergo mitosis to produce new cells to the upper layer. This picture here are stem cells undergoing mitosis. The second layer is the pericle of the spinosum layer. It is called after their spiny appearance under the microscope due to cell shrinkage. They are larger and more round cells compared to the basal layer. These cells, as you can see, have desmosomal connections, and also they are characterized by oddland bodies or called lamellar bodies. Also, they are called keratinosomes. They are intracellular granules which are rich in phospholipids and are present in the keratinized epithelium. Next layer is the granule layer. It is called after the large number of granules, the keratohaline granules or the phospholipid granules that we see in this layer. There is lipid discharge in the intracellular space, making or forming a bilipid layer. This contributes to the limited permeability and limited water loss. We have tight desmosomes and additional protein synthesis in this layer. Fourth and outermost layer is the keratinized or the cornified layer. It's the final stage of maturation, test thickness up to 20 cells. Here we lost all the organelles. We don't see nuclei, we don't see keratohaline, lipids or granules. The desmosomes are so weak and contributing later for high shedding, or called a process of desquamation, epithelial squames that are dead and they are shedded. This layer serves for mechanical protective function. Parakeratinized epithelium means that we see some nuclei present, while the orthokeratinized, we don't see any nuclei. Summarizing, we have the basal layer or stratum basale, stratum spinosum or the pericle cell layer, and then the granular layer, and above all is the keratinized or the cornified layer. The non-keratinized lining epithelium has less developed tonofilaments. It lacks the keratohaline granules and the lipid-rich lamellar structure, which was present in the granular and the keratinized upper layers. Here the epithelium is divided into rather a superficial intermediate layer along with the pericle and the basal layer. This layer has high permeability compared to the keratinized epithelium. The non-keratinocytes compose 10% of the cells of the epithelium. They are very few in number. We don't see any cytokeratins, any desmosomes, and they don't undergo maturation. These cells are uniquely clear under the hematoxylin and the eosin section under the microscope. They are of 4 types: the melanocytes, Langerhans cells, Merkel cells, and the inflammatory cells. Firstly, talking about the melanocytes, they are dendritic cells, which means they have long processes. They are derivatives of the neural crest. They are situated in the basal cell layer, as you see. they are specialized pigment cells which produce melanin pigment, contributing to the color of the oral mucosa. The melanosomes, which contain melanin pigments, are transported to the keratinocytes via the dendritic processes of the cell. Each melanocyte can contact up to 40 keratinocytes, forming together an epidermal melanocyte unit. In individuals with high melanin production, we see high activity of melanophages, which ingest the melanosomes. Other functions of the melanin are absorption of the UV light and therefore protection from the damage caused by it. They resist friction and have an antibacterial effect. The degree of pigmentation of the oral mucosa is affected by, first, the size and degree of branching of melanocytes. And it's not the number of cells, it's the activity of the melanocyte. Second can be the size of the melanosomes, the number and dispersion of the melanosomes, the degree of melanization of the melanosomes, and the degradation rate of the melanin pigment. Langerhans cells, on the other side, are also dendritic cells. They are called antigen-presenting cells located above the basal layer, and they are derivatives of the bone marrow precursors. These cells have a characteristic Berbick granules, which are rod-shaped. They have immunologic function of ingesting the bacteria and other foreign antigens present in the epithelium, and later would interact with the T lymphocytes in the connective tissue or migrate to nearby lymph nodes. So these cells, they migrate and move up and down in the epithelium. Third type is the Merkel cell. These cells are non-dendritic, so they don't have any processes. They are located also on the basal layer. They are neural crest derivative and can be seen close to nerve fibers. They act as receptors in a sensory function, and they are more common in the masticatory mucosa. Actually, they are absent in the lining mucosa. Fourth is the inflammatory cells. Mostly they are lymphocytes. Occasionally we can see neutrophils or mast cells. They have the maintenance of the innate and the adaptive immune response. Second layer after the epithelium is the lamina propria part of the oral mucosa. For descriptive reasons, this layer is divided into two parts: the superficial papillary layer, which is loose and thin collagen fibers, and the other layer, which is the reticular deep layer composed of thick parallel collagen bundles. The function of this layer is the mechanical support, nutrition, and perception. Main cell is the fibroblasts. Immune cells can be also present. The main type of collagen is collagen part 1, which establishes 90% of the extracellular matrix. It can be seen also some blood cells, nerves, and glands. Now, how the epithelium is connected to the connective tissue or the lamina propria. We have the basal lamina or the basement membrane, which is consisted of two zones, the lamina lucida and the lamina densa. The connective tissue papillae, they penetrate the epithelium with the help of also intracellular junctions. As we can see, the basement membrane on the ultrastructural level consists of proteins making the intracellular junctions, most notably the hemidesmosomes, which connect the cells of the basal layer to the connective tissue underneath. Next is the oral submucosa, which is consisted of fatty or granular connective tissue. The composition of this connective tissue determines the flexibility of the mucosal attachment to the underlying structure. It can contain, as we can see here, the blood vessels, the nerves, minor glands, which supply the mucosa and separate it from the underlying periosteum and bone or muscle. This submucosa is absent in the gingiva and some parts of the hard palate. The phenotype of the epithelium could be determined by either the underlying lamina propria, which is an extrinsic stimuli, or rather by the epithelial basal layer, which have some innate properties. The oral mucosa can vary through the epithelial thickness, the keratinization, the complexity of the basal lamina, the complexity of the lamina propria, or its submucosa. The clinical appearance of the mucosa reveals the underlying histology, and any change can reveal either systemic or localized condition. As we have noted, very small part of the oral mucosa is keratinized, which is the gingiva and the palatal mucosa, while most of the rest of the oral cavity is non-keratinized except the dorsum of the tongue. Depending on the location and the function of the epithelium, the oral mucosa are classified into three types: masticatory, lining, and specialized mucosa. The masticatory mucosa is called so because it's subjected to high compression and high friction. It has a firm rubbery structure. It covers part of the hard palate and the gingiva. This epithelium here is keratinized, is partially keratinized. It has pronounced reedy ridges and connective tissue papillae, and it has thick lamina propria. On the other side, the lining oral mucosa are not subject to high levels of friction. It has a texture that is distensible, mobile. It covers the lips, cheeks, alveolar mucosa, soft palate, ventral surface of the tongue, and floor of the mouth. The epithelium here is non-keratinized and has fewer reedy ridges. The lamina propria is loose and has more elastic fibers. The specialized oral mucosa includes dorsum of the tongue, the lingual tonsils, the gingival attachment to teeth, and the vermilion border. These will be considered in detail in the next lecture. Thank you for your attention.